Hello, everyone. I'm Andrea Corteggiani. I'm an associate editor for the Journal of Anesthesia, Analgesia and Critical Care, the official journal of the Italian Society of Anesthesia, Analgesia and Intensive Care, CIARTI. It is my great pleasure to discuss with you the recently published paper in the journal, Emotional Status and Fear in Patients Scheduled for Elective Surgery During COVID-19 Pandemic, a nationwide cross-sectional survey, the COVID surgery study. It is my pleasure because I overview the study, and it's a great pleasure for me to discuss the study with the two co-first authors, Dr. Francesca Montalto, who is a consultant in anesthesia and intensive care working in the Ospedali Riuniti, Villa Sofia, Cervello in Palermo, Italy, and Dr. Maria Chiara Ippolito, resident in anesthesia and intensive care of the University of Palermo, Italy. Let's discuss first with Francesca. Francesca, we discussed a lot in the literature about the direct consequences of COVID-19 pandemic, mainly mortality and consequence in the healthcare of affected patients. Now we are moving on indirect consequences of the pandemic. Could you discuss with us how did you think about this study hypothesis, this study thematic, and how did you implement it? Thanks.
Good morning to all, and thank you, Andrea, for the question. So the study was born during the pandemic COVID-19 period to evaluate the emotional status in patients scheduled for elective surgery during this pandemic. But why? Because during the preoperative visit, we noticed that patients tell us about their great apprehension to be operated during a period with a lot of medical restriction and a great probability to be infected. We find that this emotional status was present in a lot of patients. So we decided to study this critical condition. Approaching this at the beginning of the study, we didn't find existing data on patients scheduled for surgery, but only fragmented data in a specific population of patients. So we decided to continue to acquiring data in a larger scale. So we created this study.
Thanks, Francesca. Interesting. Maria Chiara, could you summarize briefly the main characteristics and the main findings of the study?
Yes, thank you for the question, and thank you, Francesca, for explaining the aim of the study. The study was a cross-sectional multi-center study we created with the help of professional psychologist a questionnaire consisting of 28 closed questions with collecting data about the characteristics of the patients and of the center, and with 4 study outcome questions that evaluated the fear of getting infected during the hospitalization and fear of being hospitalized without seeing the relatives and other fields, all related to the emotional status of a patient scheduled for elective surgery. The questionnaire was used in 29 centers in Italy, and the main results we found showed that almost half of the participants to the questionnaire, to the survey, were feared about getting infected during the hospitalization, and more than half were feared about being hospitalized without seeing the relatives. So I think that these 2 points are probably the main points of the study. And we also found some characteristics of the patients independently associated with a worse emotional status. For example, being affected by an oncological disease or immunological disease, or also having a relative cohabiting with the patient and being affected by a chronic disease. Okay. I think this is a good summary of what we found, and I strongly invite the public to read the results in full.
Thank you very much. Francesca, what do you think are the main limitations of this study?
Limitation of the study, for me, the first, the questionnaire was not subject to any formal validation, but was created in team with a psychologist. Then we didn't follow patients in their hospitalization, and in our analysis, we did not consider time to surgery. We didn't search association with other clinical outcome, and we did not collect data on the vaccination status.
Okay, thank you very much.
In this period, okay.
Please.
No. In this period, the vaccination was only for doctor. Okay.
Okay, thank you. Maria Chiara, in your opinion, what are the main implications of these findings?
I have to say that the nature of our study was descriptive, but of course, I think that we can use as a take-home message that every clinician today should take into account that a patient could be emotionally affected by the period we are living. So probably some of their fears can be addressed specifically. For example, use the communication campaign or in particular cases, professional psychologists help. So this can be considered at a clinician level, but probably even at a center level. For example, at a hospital level, these issues could be considered.
Okay, thank you very much. And thank you for this nice discussion. As last point, as the next scientific committee chair of CRT, I'm very, very proud of this nationwide collaboration. You can see that there is a collaborative group authorship at the end, CRT study group, and I strongly believe that this name will be published again and again in the next years due to the willingness of our society to go on with this type of studies. Thank you very much, Francesca. Thank you very much, Maria Chiara, and thank you all for watching us. Enjoy reading JAACC and the paper. See you. Bye bye. Ciao.